good morning. How this good morning can occur? This is the worst morning ever. This mother will be, these are the angry scenarios actually. Hi, good afternoon. How are you, Dr. Hassan? I'm fine. Can we get a cup of tea together? This is the Rapport building in case of improper calling. I will guide you through the patient advice and liaise your service. The thing is, whenever a person wants to complain, do not restrain them from doing complaint. This is one communication Khidir book by Khidir. It has been written and lots of scenarios are being clarified here. You have to make an index. So I have an index. If you need anyone, I will give that index. And this is another book that is named of Bakri. You know this book. This book is a very nice book and very simplified way they have written lots of scenarios. Breaking bad news. First thing we are discussing about this is breaking bad news or giving information about Down syndrome. So Fatima, a mother of 12-year-old Ali with the features of Down syndrome. Break the bad news to Miss Fatima that you suspect her baby was features of Down syndrome. This is an info giving or breaking bad news scenario. If this Ali at the age of 5 years coming to you with Down syndrome and having some specific concern, that scenario will not be breaking bad news, right? That will be more sort of an info giving scenario. So mark the differences, mark the tasks, okay? Now, introduction. Hi, good morning. I am Dr. Mohammed, neonatology registrar working in the hospital. The introduction, I used to say that one of the candidates here today. That is absolutely okay. I believe I am talking to Miss Fatima, mother of Ali. Yes, I am the one. First of all, congratulations on birth of Ali. How are you and how is your baby? I do not tell you to ask how are you or nice to meet you. So, mark these things. How is your baby? That is a sort of rapport building. Congratulating on birth of Ali and how is your baby doing? Thank you, doctor. I am fine. Actually, I am here to discuss some issues regarding your baby Ali. Is this the suitable time for you? Like the agenda of meeting or clarifying your role, attendant and arrangement. Okay, we will discuss this and I have made an arrangement so no one will disturb us. If you want anyone to attend with us, it's always welcome. No, thank you, doctor. Now come to the body part. I have been asked to sit with you today because we have examined your baby and found there are some features which are of concern. Have you noticed any abnormal features? What I noticed, his eyes are a bit upward, short neck or anything else, doctor? Yes, you are right. Your baby seems generally very floppy. As well as in hands, we noticed fingers are short and there is a single crease in the palm instead of a normal crease. Show your hand to them. In the foot, increase the space between the first and second finger is a bit increased or a bit more than the normal person, that we call sandal gap. In the face, we noticed small nose, upward slanting of the eye, like the features they have seen. Keep this in mind, all these features will be given in the question, okay? You don't have to say those by yourself. Maybe one or two features will be present. Do not say the extra features because in real you have not seen the baby, okay? According to the question, you have to assume what are the things you will say. Yes, I am following you. So what? When we always see all of these features together, we worry that your baby could have Down syndrome. The thing is, a 2-day-old baby, you have just seen the features of Down syndrome. You are not sure whether it is confirmedly Down or not because you have not done any test. So the thing is, for the assumption you are telling the mother it can be a case of Down syndrome, you are telling because you want to run some test and without the permission of the parents you cannot do any test. That is why you are saying. And in case of Down syndrome, it is written in the guideline that whenever you suspect a child is having some features of Down, please call one of your colleagues and discuss together. If both the person is having the same sort of features, like the same sort of suspicion, then you can talk to the mother, okay? I know, then the mother was saying, oh my God, what are you saying, Down syndrome? I know it's difficult time for you, but I appreciate your feelings. Shall I continue? Please look at the voice clarification. the way I am talking when I am showing empathy. The empathetic voice should be lowered in a low pitch sound. But whenever you are giving some information, you should sound louder and confident. But in case of such scenarios, such empathetic scenarios, you have to be very polite and talk it in a very low toned voice. I know it's difficult for you, but I appreciate your feelings, Mrs. Smith. Shall I continue? Yes, doctor, continue. Let me first check how much you know about Down syndrome. That is checking previous knowledge. Now, mother will say, no, I have not much information. Explain what is Down syndrome. Before I explain the Down syndrome, feel free to stop me if any point is not clear for you and ask me any question. Actually, Down syndrome is a common genetic chromosome problem characterized by typical facial features, and they have some degree of learning disability. They are also at increased risk of having various sorts of medical problems. There is no cure for Down syndrome, but it will affect someone's life throughout their life. This is not clear for me. What do you mean by genetic chromosome? Quite natural. Okay, our body consists of many cells which are the building blocks of our body. Each cell has 46 stick-like structure, and they are like in this thing they are like explaining the chromosome and gene sort of thing. Yes, doctor, but are you sure my baby is having Down syndrome? Up to this point, we cannot say your baby having Down syndrome, but these features, when collectively present, are most likely suggest Down syndrome, and we need to run some blood test to confirm the diagnosis. What is the test? We will take a blood looking for 3 copies of chromosome 21. Am I clear so far? Yes, doctor, I want to know why this happened to my baby. I appreciate your feelings. The exact cause no one knows, but the risk will increase with the age of the mother, or you have a baby before with Down. Did you mean it's my fault? Very common question. No, this is not your fault. Nobody's fault it is. It is a genetic fault for no reason. All young women, also young women sometimes having babies with Down syndrome. Whenever you will say that it is related to the age of the mother, it is related to the baby having Down syndrome babies before, then the mother will blame herself. You cannot do that, or you cannot let that happen in that mother's mind. Okay, so it's not the mother's fault. Clarify these things.